Or triglycerides. Triglycerides are a type of fat found in your blood. They're the most common form of fat in the body and are present in many foods, including oils, margarine, butter, and other dietary fats. After you eat, your body absorbs these fats and circulates them in your bloodstream. But food isn't the only source. Your body also converts excess calories, particularly from refined carbohydrates such as pastries, white bread, sugary snacks, and alcohol, into triglycerides, which are then stored in fat cells for later use. Are triglycerides the same as cholesterol? No, they are not. While both triglycerides and cholesterol are classified as lipids, only triglycerides are a form of fat. Cholesterol, on the other hand, is a waxy substance produced primarily by the liver and intestines. It plays essential roles in hormone production, building cell membranes, and supporting digestion. Despite their differences, both are important markers of heart health. Can triglycerides be beneficial? Yes, when maintained at healthy levels. Triglycerides serve a crucial role by transporting and storing energy throughout the body. However, when triglyceride levels become too high, especially in combination with elevated levels of low-density lipoprotein, LDL, cholesterol, commonly referred to as bad cholesterol, the risk of cardiovascular disease significantly increases. What are lipoproteins, and why do they matter? Triglycerides cannot travel freely in the bloodstream. To circulate throughout the body, they bind to specific proteins known as lipoproteins. These lipoproteins carry triglycerides through the blood until they are either used for energy or stored in fat cells. Monitoring the balance of these lipoproteins is critical for understanding overall lipid health. How do you know your triglyceride level? Your healthcare provider will typically check your triglyceride and cholesterol levels together through a blood test. This process involves drawing a blood sample, often after a period of fasting, to ensure accurate results. You may be asked to avoid certain foods or drinks and refrain from eating for 8 to 12 hours prior to the test. What is a lipid profile? A lipid profile, also known as a lipid panel, measures the levels of key lipids in your bloodstream, specifically high-density lipoprotein, HDL, cholesterol, low-density lipoprotein, LDL, cholesterol, and triglycerides. These individual numbers can be used to calculate your total blood cholesterol. Interpreting these results in context, alongside factors like age, blood pressure, family history, and smoking status, helps your doctor assess your cardiovascular risk. Is fasting necessary before the test? Yes, in many cases. Triglyceride levels typically rise after eating, which can affect the accuracy of your results. That's why healthcare providers often recommend fasting for 8 to 12 hours before having your blood drawn. Only water is permitted during this fasting period. What affect triglyceride levels? Several lifestyle and health factors can lead to elevated triglycerides, including obesity, physical inactivity, diets high in refined carbohydrates and sugars, excessive alcohol consumption. Managing these factors plays a key role in maintaining heart health and lowering your risk of complications. Understanding your test results. When reviewing your triglyceride levels after a 12-hour fast, these are the standard reference ranges. Normal, less than 150 milligrams per deciliter, 1.7 millimoles per liter. Borderline high, 150 to 199 mg/dl, 1.7 to 2.2 millimoles per liter. High, 200 to 499 mg/dl, 2.3 to 5.6 millimoles per liter. Very high, 500 milligrams per deciliter or more, 5.7 millimoles per liter or higher. Do high triglycerides cause symptoms? In most cases, no. Elevated triglycerides rarely produce noticeable symptoms on their own, which is why regular lipid testing is crucial. Persistently high levels can be a warning sign of underlying health issues and are associated with an increased risk of heart disease, heart attack, and stroke. When should you be tested? The timing and frequency of testing should be based on individual risk factors. Your doctor will consider your age, gender, personal and family medical history, current health conditions, and medications. Based on this information, they will recommend how often you should monitor your lipid profile. High triglycerides? Now what? Understanding the cause is the first step. In many cases, elevated triglycerides are the result of lifestyle factors such as diet and physical inactivity. However, underlying health conditions such as liver disease, thyroid dysfunction, or poorly controlled diabetes can also contribute. Often, it's a combination of multiple factors. Identifying the root cause with your healthcare provider allows for a more targeted and effective treatment plan. Does diet matter? Absolutely. But it's not just about cutting out fats. Most triglycerides are produced by your body from excess carbohydrates, particularly simple carbs like sugar and starches. Reducing your intake of refined carbs, like sweets, white bread, and sugary beverages, is essential. Instead, focus on complex carbohydrates such as vegetables, legumes, and whole grains. Replace saturated fats from red meat and full-fat dairy with healthier fats found in olive oil, nuts, seeds, and fatty fish like salmon. What role does weight play? Weight management is a powerful tool for lowering triglyceride levels. Losing even a modest amount of weight, just 5 to 10 pounds, can have a noticeable impact. Focus on the overall health benefits of weight loss, including improved energy, better heart health, and reduced risk of chronic conditions, rather than just the number on the scale. Keep in mind, any excess calories, regardless of their source, can be converted into triglycerides and stored as fat. Does exercise make a difference? Yes, regular physical activity is one of the most effective ways to reduce triglyceride levels. Aim for at least 30 minutes of moderate-intensity activity most days of the week. This could include brisk walking, cycling, swimming, or dancing. Don't worry if you can't commit to a full 30-minute session. Shorter bursts throughout the day can be just as effective. Every movement counts. Should you avoid alcohol? Yes, especially if your triglyceride levels are high. Alcohol is rich in both calories and sugar, which can quickly raise triglycerides. Even small amounts of alcohol can have a negative effect, so it's often best to limit or avoid it altogether if you're working to lower your levels. What about medications? Lifestyle changes are the foundation of triglyceride management. However, if these efforts aren't enough, your doctor may prescribe medications or recommend supplements. Common treatments include statins, which also lower LDL, bad cholesterol, fibrates, which are specifically designed to lower triglycerides, prescription omega-3 fatty acids, which can be highly effective, niacin, vitamin B3, though it should only be used under medical supervision due to potential side effects. Always consult your doctor before starting any new medication or supplement. Takeaway: high triglycerides don't usually cause symptoms, but they can silently increase your risk of heart disease, stroke, and other serious health conditions. The good news? With the right information, medical guidance, and lifestyle changes, you can take control of your numbers and protect your long-term health. HeInfo, your all-in-one destination for trusted, science-backed health information. Subscribe for more evidence-based health insights that matter.